Let's talk about muscle. We cannot have a conversation about cycle optimization if we are not talking about muscle. If you're taking notes, this is where you can write them on your phone or if you have some paper. Muscle starts with M and it has 3 actions on the body that also start with M. So they're easy to remember. The first is mobility, right? We all are able to move around because of our muscles and our bones. Muscles and bones, sisters, right? When one is up, the other one is up. So we have more muscle tissue, we have better bone density, and the opposite is also true. As we lose muscle mass, as we age, if we're not being strategic, we will also lose bone density. And this may not be important for you now if you're in your 20s or 30s or 40s or even your 50s, but I promise you in your 60s, your 70s, your 80s, mobility becomes a challenge if you're not being strategic about it. The CDC, the Center for Disease Control in the States, last year reported 300,000 hip fractures that required hospitalization. 95% of that number, they were from falls. So falling on ice, if you live in a place that's icy, tripping on a carpet, tripping on your grandson's Lego. Hip fractures. And I should say also of that 300,000, 3/4 of those individuals were female. So osteoporosis, right? Like fragility in the bone is very, very important. So that's mobility. Muscle serves a mobility function. The second is metabolic. Okay. Muscle is the primary site for insulin activity. Insulin, when you are contracting your muscle, insulin is going to come up. The insulin receptor is going to come up from inside the myocyte or the muscle cell, and it's going to express itself on the cell surface of the muscle. And that's going to allow insulin to bind if you've had some carbohydrates or something like that and you have insulin floating around. And then that's going to open up the glucose channels and allow glucose to be drained from the blood and into the myocyte. Where will be, for my nerds here, it's going to be phosphorylated, so it stays in the muscle. Once the glucose gets into the muscle, it stays there. It's like Vegas. What happens in Vegas stays in Vegas. The other thing actually on the metabolic front is women in perimenopause. If you are noticing that your labs are starting to go down the drain and you have no idea why, because you're doing the exact same thing that you were when you were 35, it's because you're losing muscle mass. It is also helping with your blood lipid regulation. So if you're seeing on your labs things like elevated glucose and insulin, like we just talked about, but also things like elevated triglycerides, total cholesterol, LDL-C, LDL particle number, this is all facilitated through muscle. Okay, so mobility, metabolic function, and then menstrual. Every time you are training, you will have a transient rise in our favorite hormone, the most dominant hormone, which is what? Ladies in the front, testosterone, right? And depending on how fit you are, that will last anywhere from 10 to 48 hours. The other thing that it does in terms of menstrual function is it promotes a healthy progesterone to estrogen balance in that luteal phase of the cycle when a lot of women are going to feel more inflamed, more agitated. Okay. The last thing I'll say on muscle, which is honestly, it's a talk unto itself. So if this is something that you'd like me to geek out on another time, I would love it. The way that women train is different than the way that men train, right? We need to have female-centric protocols for training women. And when we think about the best areas of the body that we want to be putting on muscle on a woman, we want to be thinking about the top. So we want to think about an hourglass. So the top, nice broad shoulders and back, coming into a small waist, and then a flare out in the hip. It looks good, right? So there's like an aesthetic benefit to an hourglass figure. But so beyond the aesthetics, this confers a longevity benefit, right? So when we have a smaller waist to hip ratio, and I'll tell you what that is in a moment, this is going to help with or decrease your risk for cardiovascular disease. The number one killer for women, by the way, it's not breast cancer, it's CVD, cerebrovascular disease, so stroke, and metabolic diseases like type 2 diabetes and Alzheimer's. What is a waist to hip ratio? You don't need expensive equipment. You need a tape measure. If you don't have a tape measure, I'm sure there's a local Boots, couple quid, as y'all call it, right? You go get, a couple quid and you're going to take the thinnest part of your waist. If you have had babies, that's not your belly button anymore, right? So thinnest part of your waist, widest part of your hips, you divide those numbers into each other. The number that you should get is somewhere between 0.7 and 0.8. Said another way, your waist should be about 70 to 80% of the width of your hips. This is a conversation about visceral fat, but this is something that I'm very passionate about in terms of how we can delay and even reverse some of these issues that we're seeing in our beautiful women who are perimenopausal and menopausal.